Hello, my name is Ladocsi, and I'm a board-certified plastic surgeon. I've been practicing here at Richmond Plastic Surgeons for about the last 20 years. And today, we're going to demonstrate facial enhancement using fillers. There's been a tremendous increase in our knowledge about facial changes with aging over the past few years. One important category of those changes is the gradual loss of volume of bone, soft tissue, and skin which occurs as we age. These areas of hollowing or volume loss contribute to an aged, tired, or unhealthy appearance. Fortunately, these deflationary changes can be corrected with the use of fillers. The most commonly used products are variations of hyaluronic acid, which is a naturally occurring product. Initially introduced in 2003, hyaluronic acid fillers are now available in a variety of different formulations for use in different areas in the face. These products are safe, effective, and long-lasting. They offer dramatically expanded options for facial rejuvenation without surgery, without prolonged recovery periods, and with minimal discomfort and rare complications. Patients who are treated by highly skilled injectors can expect highly satisfactory results. But today we're joined by Suzanne, who's unhappy with the appearance of her upper face. Suzanne is 60 years old and in excellent shape. Suzanne, what is it that bothers you about your upper face?
Recently I've noticed a more tired, haggard look around my eye area.
Okay. I think you look great, but I see what you mean. So when I examine you, the first thing that I notice is volume loss in your temporal area. And the area between your zygoma and this crest has clearly lost volume over time, and what was once a pretty convexity has now become a little more concave. You've also lost some volume here at your brows, and very noticeably your upper lid volume has decreased with time. And then finally, this tear trough feature is causing a boundary between your cheek and your lower eyelid. And those are all things that we can fix today.
Okay, that sounds good.
I've had excellent results over the years with the Restylane family of products. These come with different qualities for use in different parts of the face. They're soft, malleable, and give an excellent natural looking result. My goal is to create attractive facial shape, volume, and contour, as well as reverse age-related changes. My hope is that this will lead to an increase in confidence, self-esteem, and sense of identity. Equally important is to avoid pain, bruising, and swelling. Finally, I want to avoid an unnatural, heavy, or masculine appearance. Now we're ready to start the treatment. Suzanne has just had a topical anesthetic applied for about 10 minutes, and that's going to help reduce pain. Her skin has been cleaned with alcohol to reduce the risk of infection, and I'm wearing sterile gloves to do the procedure. She's also applied ice, which will act as a vasoconstrictor and also help with anesthesia. Please turn your head a little bit to your left. So we're going to start with Restylane Lift, which is a high viscosity and elasticity, and that product is going to be used to try and fill in the area between the zygoma and the temporal crest. And that's going to fill out this hollow in a very controlled, very natural way. So I'm going to start now. Are you ready?
Yes.
All right, you don't sound very convinced.
Yes, I'm ready.
All right, very good. And I'm going to continue the injections using what's called a depot method. So am I hurting you?
No.
You sound surprised. Just about 1 cc of the product. By and large, you need much less than you think you're going to need with most fillers. You can look in the mirror as we're working. And you can see a nice improvement on your right side when compared to your left. All right. Allison's going to give you an ice pack for the right side, and then I'm going to switch to the left. So now we're going to try to match on the left side what we've already done on the right. And once again, I'm going to use a depot technique, injecting small amounts of filler in the areas where it's needed. And applying some pressure and massaging in place. So one of the reasons that I really enjoy treating patients with fillers is that you can see the results right away. And they can too. So turn towards me. A little bit more up here. I'm going to be able to show you again. And a little back here. So Suzanne's only gotten about 1.5 cc's of filler per side. So take a look in the mirror. What do you think?
Looks good.
Nice and even.
Mm-hmm.
And I already see a nice improvement in your brow position. A little bit of bruising on the right, but nothing awful. I'm happy.
Yeah,
You're good?
Yes.
Okay. The next step is to apply a little bit of filler here at the glabella, and then we're going to work on the upper orbit. So turn towards me just a little bit. This is a potentially risky area because of the blood supply over here. So we're going to inject from the midline out to try and avoid any of that trouble. I'm going to inject just a little bit and then massage, and then again through that same site a little bit, and then massage. So at this point, I can say that we have softened those creases quite nicely with less than 1/10 of a cc of the product. I'm going to add a drop more in the safe, deep area. All right, so the final area we're going to treat is the tear trough along the lower lids. I'm using Restylane for that. And again, one of the nice things about this product is that it contains lidocaine, so the expected discomfort really isn't there. It's much more comfort for people than one would expect. But what I'm doing is putting my fingertip on her inferior rim, and again injecting a tiny amount of product very deep in a depot fashion so I can correct this trough and continue laterally until it's all done. And do a little bit of massage and spread this out. So Suzanne, I know one of the things you were worried about was pain. How has it been so far?
Oh, very minimal, just like a needle prick, which is pretty much what it is. But
Yeah, good. You'd feel cheated if it didn't hurt at all, so we wouldn't want that.
That's true.
Suzanne's gonna go home, apply a little Vaseline to the injection sites, wash her face as usual, and come back in about 2 weeks for a follow-up and a reassessment. And there you go, we've added softness to her face. She looks less haggard, as her goal was. That's a really nice result. It wasn't painful?
No.
Excellent. You take care. We'll see you in about 2 weeks.
All right, thank you.